Hi, Alex here, Clinic Sensei. I wanted to talk to you about something that's very, very important. It's one of the most important things or most important skills that you can possibly develop in your clinical practice. And it doesn't matter whether you're a Chinese medicine practitioner like I am, whether you're a massage therapist, an osteo, a chiro, or indeed a mainstream healthcare provider. You need to build, in fact you must build rapport with your patients. Now it sounds very simple, or sounds very obvious, but you know, it's amazing how often I see other practitioners really not putting in the basic steps to build rapport with their patient. Now this is important for a number of reasons. The first one is very simple. There is a saying in marketing which says that, you know, your customer must know you, must trust you, and must like you. Now, in order to build a relationship with someone who's going to be fruitful for both you and them clinically, it's really vital that you build rapport with them. So when does building rapport take place? Well, it happens at that first encounter that you have with them. Now, it may be on the telephone, it may even be over the internet by email, and it certainly happens when they open your door for the first time. I believe that the best time or the best chance of making that first impression that's going to build rapport with your patient is in the space between them opening your front door and entering your clinic, or approaching you when you're at the front desk, or if the first time is meeting them in the reception area. It's those first few seconds that really are going to set up your opportunity to build rapport with that particular person. So what do we need to do in order to build rapport? Well, rapport really is about starting to build a connection with that person, build a relationship. In this case, it's a doctor-patient relationship or a practitioner-patient relationship. It's very important. What I do, and this is only one way of doing it, what I do is to make sure that I connect with that person as soon as they walk in the door. I introduce myself. I make eye contact. Now some of these things sound very obvious and very plain, but these are little aspects that often get forgotten or left out, and you cannot afford to do that. So to build rapport, you must make eye contact, you must introduce yourself either with a warm, friendly handshake. Don't try and break someone's hand as you're shaking for the first time. You want to build genuine sense of warmth with that person, and by making eye contact, using good intonation and clarity with your voice, and introducing yourself is incredibly important. So by the time that person either gets to the reception counter where you are, or into your office, your consulting room or your treatment room, you should already be building rapport. And I know this works as a fact. Someone enters, "Hi, how are you? My name's Alex. How's your day been?" Or, you know, you try and find something that a point of interest for them, or try and learn something about them very, very quickly, so that you start to build that sense of a relationship. And the second thing, and it comes down to listening. And this is really step two. Once you've got them into the consulting room, it's very easy for a practitioner to believe that they have all the answers. It's very easy for a practitioner to think that, you know, they ought to be doing the talking. I think in most cases, particularly in Chinese medicine where we do take quite a lot of oral history, is that we need to really become very good listeners. So part of building rapport is not only communicating your warmth and your empathy to that person, but also listening very carefully to what they have to say. And it's amazing to me how important that aspect of the consultation is. In fact, very often we find that people will come in and they'll say, at the end of the spoken consultation, prior to doing any actual treatment, they say, "You know what, Alex, I feel better already, because you've listened, you've understood, and you've taken the time to explain exactly what it is you're going to do and the way forward with this treatment." So I think that building rapport has a lot to do with how you relate to your patient. In fact, it has everything to do with how you relate to your patient. And it begins perhaps on the telephone, perhaps it begins by email, but it certainly begins face to face when that person when that person first walks through your front door. And you know, keep it a little bit light, don't be too heavy, learn to be an awesome listener. If you are a great listener, your patients will be very, very happy. So remember that, you know, people will come to you because they want to trust you, they will value your knowledge and your expertise, and they will most importantly value your listening. Just out of interest, have a look at this. If I sit back and allow myself to listen very carefully, I get a really good sense of what's happening, but the patient feels a little bit like I'm backing away. If I just allow myself to come forward that little bit, I'm still listening as intently as I was, but now I'm engaging that person more closely. I don't want to be right I don't want to be right in your face, but certainly I want to be showing interest in what that person is saying. So building rapport. As soon as they walk in the door, I reckon you've got about 5 seconds to do it. If you don't do it in that time, it's an uphill battle from there. So put this into practice. Start building rapport with your patients as soon as you have that first contact. That first contact is the most important point. And a friend of mine told me a saying once. He said, you don't get a second chance to make a first impression. How true that is. How true. So get out there, build those relationships, have a fantastic ability to listen, be an awesome listener, and your patients will love you for it, and they will benefit extremely. So good luck with that. Look forward to speaking to you again soon.